Hello, best regards from the Stockholm, from the EHA meeting here, and I would like just to briefly share with you the data we presented yesterday. It is the work on behalf of Czech Lymphoma Study Group. We have a prospective project called NIHIL, which covers all non-Hodgkin lymphoma subtypes. This is the observational project, and we cover different subtypes. And our work presented here was focused on the follicular lymphoma. We know that the follicular lymphoma has nowadays very good outcome. The median overall survival is coming close to the 20 years. But there are still subgroups of patients who failed the treatment. And what we use in the clinical practice is some prognostic indexes like the FLIPI or FLIPI2 and some others. Lisa introduced in the last ASH so-called PRIMA prognostic index, which is a prognostic index based on the cohort of patients treated within the PRIMA study. The patients treated with the immunochemotherapy and then randomized to the observation and rituximab maintenance. And it's really very easy, a very simple index. If the patient has a beta-2 microglobulin level higher than the 3 milligrams per liter, he belongs to the high-risk group. If he has a lower level of the beta-2 microglobulin, but he has bone marrow involvement, he belongs to the intermediate risk group, and if he has normal beta-2 microglobulin level and no bone marrow involvement, it's a low-risk patient. We tested this index on the cohort of the 1,179 patients. And what we have observed is that it's really very simple. In our hands, it seems to be a bit better compared to the FLIPI or FLIPI2. But the main message we shared yesterday is that this index can show you the patient who are at higher risk to die, although they are late progressors, or it means although they are not early progressors, because this is the group which is usually considered to have a very good outcome. And we have shown that the patients who belong to the high-risk group have a 2.6 times higher risk to die compared to the patients who belong to the low or intermediate risk group. So it could have the clinical implication, because then probably you could think about a more intensive treatment for these patients who relapse later, but who have high risk according to PRIMA prognostic index.